Hello, everyone. Thanks for joining us today. Today is February the 15th, 2024, and this is PACO's Workers' Compensation Roundtable. Today, we have with us John Bauer, an attorney with Polling, and he's going to be talking to us about opioids in Ohio workers' compensation claims. Let me just tell you a little bit about John before we dive in. John's primary focus is in defending self-insured and state fund employers before the Ohio Industrial Commission, as well as in state courts on appeal. John, in law school, John worked on the legal research team at the Ohio Industrial Commission. So he's been involved from the get-go, it sounds like. And he learned how hearing officers make decisions, and now he uses that knowledge to his client's advantage. An interesting fact that I just discovered this morning is that John's undergraduate degree is a Bachelor's of Music, concentrating on violin from the Wheaton College Conservatory of Music. And then he obtained his Juris Doctor through the Ohio State University Moritz College of Law. Prior to joining Polling, John practiced civil litigation for several years, winning many cases via summary judgment and maintaining a perfect record at trial. That's an awesome track record. John has made court appearances in over 50 Ohio counties, and his name, face, and good reputation are known by judges throughout the state. I will now go ahead and turn things over to John. John, welcome. We thank you for being here and sharing your professional expertise with us, and looking forward to what you have to say today.
Yes, thank you for that introduction. It was very kind, and I'm happy to be here. Hopefully, you can learn a little something from what I'm going to share today. Well, anytime that I talk to anyone about workers' compensation, I go all the way back to the beginning of when the workers' compensation system was formed, and I can even feel my wife's eyes rolling from here. She's heard about this kind of stuff a lot of times, but the Ohio workers' comp system is relatively new. It came to be through some constitutional amendments in 1912. And before 1912, the common law required that a claimant show fault or negligence on the part of their employer before they could recover anything for their treatment or the wages that they had lost. And so they had to prove that the employer was responsible for the incident, and there was rarely recovery for the injuries. But when there was recovery, it could put employers out of business. And so employers and employees each gave up certain rights to get the workers' comp system that we have today, so that injured workers can more quickly and more easily receive compensation and payment of medical bills without proving fault, and employers don't need to worry about an injury putting them out of business. And so, with that sort of framework in mind, one thing that is unique to Ohio that I want to highlight up front and that employers often complain about is that in Ohio, injured workers have free choice of physician. And so an injured worker has a right to choose their provider, and they have a right to change a provider. So an employer can recommend someone that they go see. They can have a nurse on site that they meet with, but ultimately, again, injured workers have a free choice of physician. And so there's a notice to change physician of record form that you may have seen before or may see regularly, where they can just, the injured worker puts their name, the name of their old treating physician, the name of the new treating physician, and a little reason for the change there. And so I just bring that up. Let me show you an example here. This is the kind of thing that can be very frustrating for employers. I have a claim here. I tried to redact the information where the injured worker was cleared to return to work. You can see on the bottom there, it says he was released to try to get back to the position of his employment on September 6, 2023 by his treating physician. The injured worker changed who his treating physician was, and this new doctor said that he actually can't return to work it's too difficult for him, and they requested a functional capacity evaluation and a vocational rehab as well. And so
I'm
this,
sorry, excuse me, John.
yeah,
Your slideshow doesn't appear to be running.
it doesn't. Thank you for telling me. Is that better?
Yes, there we are.
Okay, great. So just to show you then, I'm gonna go back a couple. Um, this is this page has screenshots from the Bureau's self-insured manual. This is a resource that's just available. There's a PDF document that helps self-insured employers implement their self-insured program. And so I took these screenshots from that manual. Included in there is the free choice of position section. When I have employers that do work all throughout the country, sometimes they're not as familiar with all of the Ohio intricacies. And so I point them toward this self-insured manual. And this would be a resource that in a section that I recently referred an employer to because they're not used to the free choice of physician. This is the notice to change physician of record form from the BWC. And then these are one of the medical records that I was referencing about the employee who changed physicians so that he could get taken off work and referred to vocational rehab. And so that brings us then to issues related to opioids. And so this is a medical record from one of my claims where the injured worker was trying to get a prescription. I can't remember what the drug was specifically, but he followed up with his doctor and said, "Looks to me like I passed the urine test. Are you able to process it now?" And the doctor responded that because he was positive for THC, he was unable to prescribe the opioid medications for you. And so while in Ohio we have the free choice of physician and the injured workers can sort of doctor shop, um, there is a more uniform set of standards for when opioids can be prescribed, so that an injured worker like this one can't just go to a new doctor, say, "How about you give me the opioids that I want," and get prescribed those drugs from someone else instead. And so, just as a little bit of background, and as I'm sure you know, um, Ohio has a more of a problem with the opioid epidemic than other states nationally. The highlighted part here is about the age-adjusted overdose fatality rate in Ohio, significantly higher than the national average. And it notes here that it's due in part to a sharp increase in adulterated heroin overdose deaths since 2016. And so to the Bureau of Workers' Comp's credit, in 2016, before this sharp increase, they adopted or came up with this common sense initiative. And in the common sense initiative, the BWC proposed to adopt new opioid prescribing rule. And that's what we're going to discuss here today is this new opioid prescribing rule from the Ohio Administrative Code 4123.621.7. And so this section of the administrative code is titled Reimbursement of Opioids and the Treatment of Pain for a Work-Related Injury or Occupational Disease. And so basically, I'm going to try to avoid just reading this to you. But there's certain criteria and practices that doctors must follow to document and show that the opioids are required, and only certain amounts are allowed to be prescribed as well. And so point B here discusses how certain prescriptions for opioids won't be reimbursed, as well as some other consequences for doctors who do not follow the rules, including the last one mentioned there is decertification pursuant to the rule. I just think it's also worth noting that while not following these rules can lead to decertification, obviously doctors are subject to federal rules and state medical boards. There are other governing authorities over what doctors can prescribe. And so this is a new story from 2023 about a doctor in Niles, Ohio that pled guilty to 52 federal charges related to the distribution of controlled substances. And so um, that's not really what we're talking about, though, in the workers' comp setting. In in the workers' comp Ohio BWC setting, we've got this framework, like we discussed, where employees and employers each give up certain rights in exchange for participating in the system. And so there may be drugs that would be appropriate or totally fine for a doctor to prescribe to a patient that the BWC has decided that they are not going to reimburse. And so just because a doctor does prescribe or may try to prescribe an opioid to a patient that does not comply with these rules does not mean that they're committing a federal crime, if that makes sense necessarily. Okay. So what this rule does is it breaks it up pain into two categories: opioid utilization for acute pain and opioid utilization for subacute or chronic pain. And so we have C is acute pain and D is for subacute and chronic pain. And so for I guess let me look at show how this rule works first. And so um, reimbursement for ongoing opioid prescriptions for acute pain will only be provided when the prescriber has both complied with Rule 4731.1113 of the Administrative Code and has documented in the medical record the appropriateness and safety of the medication in the same matter as in other sections of the Administrative Code that we'll look at too. And so then that begs the question of, what does 4731.1113 say? And so this is the section that deals with acute pain. And so it goes through, the rule is a few pages long in a PDF document, and it works through what the physician must observe and document before prescribing the opioid treatment, and how much and for how long it can be prescribed as well. And so the first requirement is that the physician must consider non-opioid treatment, and they must document why they are not prescribing non-opioid treatment as well. Second, the physician can only prescribe the minimum quantity and potency needed to treat the expected duration of the pain, presuming 3 days or less. There are limits and prohibitions on refills. I can pull up the actual statute here. Does that come on the screen?
Yes.
That does? Okay. And so you can see here that for adults, not more than a 7-day supply can be given with no refills. For minors, not more than a 5-day supply with no refills. And then there's this part here, though, that it can be exceeded for pain that is expected to persist for longer than 7 days, depending on the pathology of the pain. But again, it shall be documented, and that's a primary thing, is that the doctors need to document what they are doing, why they are doing it, or why they are not using other alternative treatments too. There's also an exception here for certain conditions or certain surgical outcomes or injuries that are so severe that they just acknowledge that there's going to have to be stronger painkillers given, and that would be like a traumatic crushing injury, amputation, major orthopedic surgery, and severe burns are the ones listed here specifically. Um, the it doesn't need to be one of those four specifically enumerated injuries in order to qualify. It says based on prevailing standards of care, such as, and then it gives those four as examples. Let me just pause here. Does anyone have any questions at this point? Any thoughts? No? Okay. All right, I'll keep going then. So then the next section over in the Ohio Administrative Code talks about subacute or chronic pain. And I'm just going to pull up this as well. Yeah. So this is much longer. And there's 6 pages here of the Ohio Administrative Code dealing with this section. And again, it says that they shall first consider and document non-medication and non-opioid treatment options. And so if you're reviewing a request for opioid treatment, you want to review the physician's notes to see what they considered, what more conservative treatment they've tried, why it hasn't worked, and why they think that this is the option that needs to be prescribed to the patient. The physicians must document patient record assessment activities to assure the appropriateness and safety of the medication. And so this includes the history and physical exam, any laboratory or diagnostic testing that's been done, and you have to review the results of an ORS test, which is the Ohio Automated Prescription Reporting System check. There has to be a functional pain assessment, which includes the patient's ability to participate in activities of daily living. There has to be a treatment plan that includes each of these things: a diagnosis, objective, rationale for the medical choice, plan duration. So you can see that this all needs to be well documented and thought out, and not just, well, here's the medication that will make your pain go away, without any of this documentation. And so at this point, let's see here, yeah, I think you may be thinking, so what at this point? And so So I put up an example here. This is a letter that I wrote in preparation for a hearing where someone was requesting a certain biomed formula, like a compound cream, to treat their pain. And so in this particular instance, the treating physician included in the office notes that due to the chronic nature of the person's pain, I feel he would benefit greatly from the use of a compound pain cream to manage his symptoms. And so let's just look back. And so what we know from here is that a determination of whether the pain is acute or chronic is just the beginning of an analysis of what type of medication may be required or appropriate. It's not the end. And so that's what I wrote in this letter. Determining whether a patient's pain is chronic is not the standard for determining whether this compound cream is medically necessary. The employer in this case had a reviewing physician take a look at the medical records and outline the medical criteria in his review of it. And he found that it wasn't medically necessary because of the reasons listed here, because there was a strength available that didn't require this particular kind of formula. The patient had not there was nothing documented in the file about an intolerance or contraindication to the other available formulas. And third, um, there was no documentation that the patient was unable to use a pill form of the drug or a different kind of formulation other than the cream. And so the employer challenged the requests for this compound cream. Oh, I didn't perfectly I didn't perfectly redact this, but I don't think it would be meaningful to anyone. And and argued that it was not necessary and that the bureau should and the industrial commission should deny the request for this compound cream.
So by this compound pain cream, are you talking about something like a Voltaren gel or a prescription strength Bengay or something like that, or is that something different?
I don't remember.
Okay,
I
that's
don't,
fair.
and so what um so the way that these can usually come up in a claim, and Angela, actually, let me ask you first. How have you seen these come up in a claim of yours before? These issues with the
I don't recall seeing anything like a specialty compound cream being made by a pharmacy. Which is why I wasn't quite sure what that is. And I'm 29 years into this field, and I can't recall seeing anything like a compound cream or medication.
Okay. How about a specific situation where someone requested an opioid or a pain management consult or something for some chronic pain? Have you seen and the employer has challenged it? How has that come across your desk before?
Um, unfortunately, mostly it's been we have challenged this and now it's set for hearing, go and go forth and conquer. We did have one, and very soon after um, the the first um, Ohio Administrative Code came out for, governing the use of narcotic pain medications. We had one that we had a medical record review from a doctor who said that the medication wasn't appropriate, it wasn't medically necessary, and that the doctor hadn't documented in his notes appropriately the use of the medication. We ended up filing a mandamus action,
Okay.
and the outcome of that was that they kicked it back to the industrial commission to write a new, to rehear it, simply because the statute by then had changed again.
Okay.
So going through the motions, but not really getting a result.
Yes. Okay. So, what was it that tipped you off that there was an issue worth challenging in that circumstance?
It was a matter of this gentleman had a claim that was 10, 15 years old. He had been, I think it was Vicodin or Percocet, one of the two. He had been, I mean, that was pretty much the only thing that he wasn't getting active treatment like injections or physical therapy or surgery or anything like that. It's just month after month after month after month. The doctor kept prescribing, I think it was Percocet, and that can get very expensive. And so the employer finally got to a point where they're like, no, we're not going to pay for this every month, so we're going to challenge this.
Yeah. I think that's good. So I think that that kind of corresponds with one of my examples that I was thinking of, where you have an old claim where the person is continuing to treat and receive medication for pain that, frankly, the employer probably thinks they shouldn't be experiencing anymore at this point. The costs are growing, and you're thinking, how do these keep getting submitted and approved? What's going on here? And so you end up taking a look at maybe more of how it's being documented. You recognize there's very thin documentation on the part of the treating physician. It's like, I think that we should challenge us to try to stop this like ongoing, never ending treatment cycle. Is there a physician
Yes.
we have who can review this file and say, it's not documented properly, this request should be denied?
Yeah. And it's such a good thing that we now have these guidelines, because I remember Gosh, at my last firm, we had a claim that, I mean, the guy had a couple of different lumbar disc herniations. He had had surgery a few times, but he was being regularly prescribed Vicodin and OxyContin and this and that. And our reviewing physician basically said, nobody takes morphine at these dosages and continues to function, yet this guy is out riding his motorcycle. And we don't understand how that's even possible.
Sure. Yeah. That's good. Can anyone else think of, does anyone have any other questions about this or anything that you can think of where you've seen or would maybe see red flags that this is something that you should consider challenging and having another physician review?
Well, that's a good question. If an employer wants to challenge ongoing prescription medications, in particular narcotics, um, is it adequate to go into a hearing and say, here are Dr. Smith's office notes over the past 2 years, and here is the code, and clearly he's not documenting properly what he should be documenting. Is that sufficient, or do you really have to have a medical review or an IME or some kind of defense medical that has a doctor say he's not meeting the criteria?
Sure, that's a good question. I'll keep it quiet for a second to see if anyone else wants to chime in before seeing all muting and no faces. I think the I think that it could certainly be worth um, what's really useful, I guess, about the Ohio Industrial Commission is that you have the DHO level hearing and an automatic right of appeal to an SHO hearing. And something like this, I'm not sure it would take a reviewing physician, if you needed it, very long to go through and see whether or not something was appropriately documented. So if you have a cost conscious client who is not sure about having an independent medical review to give the opinion that the documentation is inappropriate and the request for the painkiller should be denied, I think you can try it out at a DHO level first and see and argue that it's insufficient. I think that lots of hearing officers like to have medical evidence to rely on to say, well, this doctor's prescribing it, so he thinks that it's okay. And I would like to have another doctor to rely on who's saying, that's not how I would document it. That's not sufficient. So I think that it's certainly possible and maybe even probable that you could win without a reviewing physician. But I think sometimes the practicality of making a hearing officer's decision is worth going through the process. So I like to go into a hearing saying, you should deny it, and I'm not just giving you a medical opinion that these notes are insufficient, but here's another doctor saying that it's insufficient too. And you should deny it based on his opinion, not my opinion as the attorney.
Okay.
But I am very almost always willing to try it out first at a DHO level without it if the client is cost conscious, and tell them in advance that if we lose, it may be worth getting that opinion, and here's who I have lined up to give that opinion
Yeah.
in the event that we're in a time crunch too.
Okay. Thank you.
So I think that answers. I made a couple examples here, but I think that our little conversation there is probably more helpful even than them. When we're thinking about acute pain, an injured worker crushes their hand and goes to the hospital, they're going to be able to get the painkillers they want and need um, at relatively high dosages to take care of their pain in that sort of acute emergency situation. Um, and then, like in my case, where we have a treating physician state something like, this person would benefit from these painkillers to manage chronic ongoing symptoms with a C9 for maybe a pain management consult or something like that. That should be a red flag that is not sufficient documentation, and it may be worth challenging that C9. All right. Well, before we move on and maybe shift gears, does anyone have any questions about what we've talked about so far, or anything you want to chime in with? All right. Well, um, oops. Here we go. So in the fall, issue 2 passed in November here in Ohio. And there's been some conversation among employers. Clients have reached out to me and asked the implications of it. Employers want to know, what does the legalization of this marijuana mean? And just a little bit about what issue 2 did and didn't do. Um, it legalized the private use of marijuana for non-medical recreational purposes. Employers, though, are not required to change existing drug policies, nor are they prevented from adopting new ones. So employers may continue to establish and enforce a drug-free workplace policy. Employers do not need to accommodate marijuana use, and employers can discharge, discipline, and take adverse action against individuals because of marijuana use as well. And one thing that I think that came up with an employer that I know, is that they are involved in the Ohio BWC's drug-free safety program. And in, I think it was 2019, when prescription marijuana was legalized in Ohio, the Ohio BWC did not change anything about their drug-free workplace standards. And so they still required testing for 5 substances under that program. They still required testing for cocaine, marijuana, opiates, amphetamines, and PCP. And so at that time, the BWC's position remained that a drug-free workplace is a marijuana-free workplace, even in the medical marijuana context. And so today, even after the Ohio has legalized the private use of marijuana for non-medical recreational purposes, still seems to be the BWC's position that a drug-free workplace is a marijuana-free workplace. And so there are some employers that have not signed up for the official Ohio BWC drug-free safety program, but they may operate under what's called a comparable program in order to be able to work on state projects. And so this may be like construction companies that want to help repair or improve state buildings. They're not required to follow the full drug-free safety program, but they're required to operate under what's called a comparable program. And under those comparable programs, the employers must have a policy that states that no alcohol or drugs is to be in the employees' systems while working on a state job site. And so even in the way that that's stated, no alcohol or drugs, it kind of is instructive on how the BWC views marijuana in this new context. And I think that it's that employers should treat marijuana and alcohol similarly, in that should not be in an employee's system. And in the way that you can, I guess, sort of monitor that is through observation of behavior and recording what we call in sort of the litigation, the workers' comp litigation setting as the reasonable suspicion. And so I'm just going to pull up this slide, and this is about how employers can get a rebuttable presumption in the drug use context in workers' comp litigation. And so employers can benefit from a rebuttable presumption that intoxication or influence of a controlled substance was the proximate cause of an injury and not employment if a few things are in place. So first, the employers must have statutory written notice that drug testing may impact workers' comp benefits. And so when a claim comes in and there's suspected drug use or a positive drug test, I'll ask the employers to take a picture of and send me their statutory written notice. So this is usually in a break room or a place where, yeah, it's posted on the wall in a break room. They'll just be able to snap a picture of it, say or confirm that it was up since, January 1st or whenever it was, and we'll be able to provide that in the industrial commission file. I'll also ask them to provide a written policy about drug testing. Some employers have, I guess they have different policies, but some have immediate drug testing following an incident on site. They need to provide that policy, and I prefer to have a sign off that the employee read it and acknowledged or has had training on that policy as well. Then they have to provide the testing procedures. So here's when, why, how we test. But on top of all of that, Angela, you have something to add?
I have a question that just
Yeah.
came to me. You were talking a few minutes ago of having either a drug-free policy program or a comparable program. How does a workplace environment that involves people who might be subject to DOT requirements, how does that fit in?
Yes. That is a very tricky subject that employers are trying to sort out right now. And because it, just like by way of example, we were talking with like a national construction company that works on a variety of different type of projects, and they're trying to sort out, should we have different employees designated for different types of jobs. So maybe an employee doesn't pass, they take a test when they are applying for their job, a pre-employment drug test, and it tests positive for marijuana that has been in their system sometime in the last 30 days. Well, maybe they can be designated for a non-DOT job or a non-state funded project in Ohio if Ohio doesn't want that, while another employee who does pass that test can do one of those other jobs. Um, but that is a very labor intensive, difficult job for an employer to do, because then what if someone who passed that test later doesn't? Then do you move them to a different type of job or a different type of job
Yeah.
site? Are you discriminating in your employment decisions based on that inappropriately? Um, there are a lot of landmines for employers to navigate with this.
Okay. But what about something a little bit more
Sure.
straightforward, like a truck driver? And I'm sure
But
DOT rules require that they not be under the influence, they not be using
yeah,
illegal illegal substances, which marijuana still is federally illegal.
yes. And that's again where I think that it's wise to treat it like, I think the best guidance that I can think of right in this moment is to treat it like alcohol. So in the same way that a truck driver could legally drink alcohol, but they cannot be under the influence of alcohol when they're driving, um, they should not be under the influence of marijuana when they are driving either. Um, but if I were a truck driver, I wouldn't be under the influence of marijuana ever. I don't know. What do you think?
Yeah, I mean, it seems to me that, if you're a truck driver and you're subject to DOT regulations, then your employer would have every right to demand the same, and that you be drug free at all times while you're working.
Yeah, I think that's fair too.
Okay.
Um, so just back to the workers' comp context then too, real quick, is the issue of reasonable cause. And so um, a positive drug test isn't necessarily enough to obtain the rebuttable presumption that the intoxication or influence of the controlled substance was the proximate cause of the injury. Um, you have to show that there were behaviors, something that you observed about the person that could have caused the injury, that the intoxication caused them to act in such a way that caused the injury as well. And so you want to get statements from witnesses, people on site, people who are around who can explain that there was reasonable cause for a test or reasonable cause to believe that the intoxication caused the injury and not just something that's related to employment generally. I can think of a claim that we had where a woman tested positive for cocaine in a post accident drug test at a very high level. But because she was hit from behind with a forklift, the Industrial Commission found that her intoxication played no part in her injury. I saw
Except
that.
maybe she shouldn't have been where she was at the time she was.
Yes, maybe she didn't know where she was or why she was there or anything like that. That's very true. But the witness statements are really important when you're sitting in the hearing arguing that the intoxication caused it, to say, I noticed this person acting irregularly as they were coming in for their shift, or there was no reason for them to have tried to put the press down at this part of the process. Um, or I observed their bloodshot eyes in the morning, and I had never seen anyone operate the machine in the way that they were operating it. Those two things made me think, what's wrong with this guy today? You know, those kinds of statements go a long way in litigating these kinds of issues. Um, I already mentioned that. Um, so I think that that's everything. Yeah, that's all the slides that I had. Is there anything else that anyone wants to talk about opioids, marijuana, other drug use?
Well, what about, you talked about the rebuttable presumption, but what about, you've got a positive drug test and maybe it doesn't qualify, it doesn't meet all of these standards. Maybe there wasn't a reasonable cause for the drug test or something I know sometimes we will try to get a doctor to review the records and say that, okay, maybe the medical records show that there was a positive drug test. The medical records show that, the witness statements show that, and I believe that they were under the influence at the time, which was approximate cause of. And how do you get that in? How do you work that?
That's so yes, the at a workers' comp hearing where the employer is challenging the compensability of a claim, the standard would remain the same, that the injured worker must prove by a preponderance of the evidence that um, an injury was work related. And so I'm trying to think of what think of a good example here. And so just because the employer is not entitled to a rebuttable presumption does not mean that the injured worker automatically meets their burden of proving that the intoxication was not a contributing factor to the cause of the injury and maybe would prevent them from meeting their burden of proof. Which I think is what you're suggesting, right?
Right.
Yes. And so uh I can't think of a specific claim where I've been successful in that way. Do you have anything that comes to mind?
Um, Again, it's been a number of years since something like this has crossed my desk, but I remember getting quantitative drug results, not good enough that it was simply positive for cocaine or positive for marijuana, but getting the quantifiable results saying at this rate, at this level, and then sending everything, the witness statements and the medical records and the drug results to I can't even remember the doctor's name up in Mansfield. And he would review the records and provide a report saying that the medical records indicate that he was under the influence of these drugs at the time, and that the injury was the drug use, the intoxication was the proximate cause of the injury, and being successful with those
Yeah.
uh, several times.
Yeah, I can think of a relatively simple and normal workers' comp claim where someone says they like tripped over a mat, landed on their shoulder, they have a shoulder strain, and at some point they're going to be requesting a rotator cuff tear too. And perhaps there was a drug test and it showed that they were under the influence of they were intoxicated at the time, but not entitled to a rebuttable presumption. And I could see a situation where you could get a doctor to say, you know, they were intoxicated. That was the reason they fell, not because their toe happened to hit the mat. And so, because they fell because of their intoxication, the injury is not work related, and therefore it's not a compensable claim.
Yeah,
Yeah,
that's what we had done in the past on
yeah,
a few things.
yeah. That's a good point. Thanks for bringing that up. Um, any other questions or anything else anyone wants to discuss?
I can't think of anything.
Great. Well, I feel satisfied.
Okay, very good.
I don't know. Yeah,
Very, very good.
we're a few minutes short.
It's all right. If there are no other questions and no more discussion, we'll go ahead and wrap up for today. John, we want to thank you again for sharing your time and your expertise with us. And we want to, of course, thank Megan Rogers and Spectrum Reporting for providing today's Zoom link and recording today's session. We will have the session up on the website in the next several weeks. So if you want to go back and review, or if you know someone that was unable to join us today, they can certainly go back through under the members only tab and access that recording. Thank you everyone for attending today, and we will see you next time. Oh, okay. What is up next month? I have a speaker for next month, and it's escaping me who it is. I think it's a case law review. Let's see. Workers' Comp Roundtable, March 21st is our next session. And yes, Attorney John Goodman will be joining us for a case law update. And I'm sure that he will discuss at length the AutoZone case and what that has done to voluntary abandonment issues in Ohio. So that will be an interesting discussion, I'm sure. You'll want to join us. And I think registration goes live today for that. So you can go to the website and register for that. And we will see you then. Also upcoming, let's see, other events. I know we've got, oh gosh, what is our next event? Our general membership meeting next Tuesday on the 20th. I do not have any idea how to pronounce this gentleman's name. The first name is Shafi, and I will say Saidudin, and that's probably wrong. He is the owner and operator of Pineland Investigations. I'm not sure if that's the exact name of the company. But he's going to talk to us about different intelligence gathering and how that affects the legal community. That's on the 20th. And then our legal insights session in February is on the 29th. And that on that day, Judge Deborah Turner of the Cuyahoga County Court of Common Pleas is going to join us for a Black History Month oriented discussion. And that doesn't tell me what it is that she has ready for us. Her presentation is going to be called A View from the Bench, Paralegals, Valuable Members of a Legal Team. So you will want to, I'm sure, join us for that. Lots of good things going on. Don't forget, the second annual food drive is ongoing through the end of the month. We have a number of collection sites. If your firm wants to collect items and bring them to us individually, that's great. That's always appreciated. And of course, you can go to the website. There is a link that will take you directly to Mid-Ohio Food Bank if you would like to make a financial donation on our behalf, and that will take you directly to their site. You can make your donation. They'll give you your tax receipt, and they will also notify us of your gift on our behalf so that we can thank you afterward. So that is what's going on. A lot of things happening. Check out the website on the news page for more details. And yeah, we will hope to see you next week for the general membership meeting on the 20th. And with that, I will give you back the last 8 minutes of your lunch hour. Thank you so much, everyone.
Thanks a lot.